Hey everyone, I'm Shatia Jones. I am a Master's of Sociology student here at Arizona State University. I'm actually in my last class, capstone class. Lord's willing, I will be graduating on December 10th. Yes, this has been a long road, but I know the reward will be great in the end, and I am looking forward to the end. Um, Right now, I work as a licensed social worker in a long-term care facility. So with social work, I've basically been looking more at the individual. But with sociology, I know that it's more broad and it will allow me to focus on like the individuals in their environments. So with that being said, today I will be discussing planning coverage in the workplace, and it's basically about managing it in the state of Texas. Last semester, me and my group in Capstone 2, we was in a religion group, and we decided, there was so much, debate on family planning coverages and how people have different views on it. So we thought about that and we decided to look at the state of Texas about their family planning coverages for women, basically in the workplace. I know I myself, this topic is personal because I work for an organization that they do not offer family planning. Basically, you have to pay for everything out of pocket. They don't offer a lot of benefits to their employees, which I think is really sad. But like I said, we found a lot of information. We found this to be really interesting, and I hope you all do the same. So we're just going to go ahead and get into our presentation. So before we get started, I just want you to take a moment and just imagine yourself, in grad school or in college. And right now, you know that having a family, is something that's right now is not an option. Um, of course, we know there are more preventative measures, but you want to be responsible and just say you want to do some family planning, get on birth control, to take a preventative option, before you have a child, which is a lifelong commitment. So just imagine it for a minute. And imagine, you being in a place that don't offer that coverage. This could really affect your health care, let alone it can affect, your life because you will have a responsibility. So just take a moment and think about that. So, with that being said, the summary of the issue today um, is basically we're talking about Texas business owners not offering family planning coverages, how opting out affect the low income and rural women. On this page, you will see President Barack Obama signing the Affordable Health Care Act. And with this act, he done a lot. It was a great thing for the United States. But of course, there was a lot of people mad about it. But he was taking an approach to try to get health care for the underinsured and low income people in the US of A. So with that, he signed the act, and with the act, it basically had employers to insure. Well, they had to insure their employees with health care and also give, cover contraceptives in the healthcare. Um, but with this, a lot of people got upset. A lot of people got upset about it. But, at the same time, he was trying to do what he thought was morally right. But a lot of people did not like that he had that Affordable Health Care Act. So in 2012, there was a big fallout with the Affordable Health Care Act and a lot of religious organizations in the United States. So basically, over 43 organizations, including churches, schools, hospitals, and others, claiming religious affiliations filed lawsuits against the United States government on the basis that they did not want to be required to provide contraceptives at no extra cost. They were mad. They were saying, no, this is not what I believe. I will not offer this coverage. It is against my religious belief, and I have the freedom of speech and to exercise my own religious liberties. So we're not going to do it. So they filed a lawsuit, and about 25% of these people, the groups, were from Texas. So in 2013, when all this happened, Texas also opted out to receive the Medicaid expansion program, which they lost over 35 million federal dollars that could have helped save clinics and provide the contraceptive coverage to low income women. They opted out of it. Instead, they created a Healthy Texas Women program that funded the state as a whole. This provided low income women with health and family planning services at essentially no cost. But of course, you had to have a certain income level. I think in Mississippi, which I'm from Mississippi, I think this is called family planning coverage in Mississippi. Um, but this new program gave the state the power to choose providers. So they chose what provider you went to. And of course, if it was against their moral belief about the organization, they did not cover you to go to that provider. Now, with this marked a huge decrease in healthcare services in the state of Texas. With this, from you'll see on the slide, from 2011 to 2016, 39% of women healthcare services went down, and 41% of women receiving contraceptive services went down. So it did mark a huge decrease in the state of Texas. Now, with this, Texas kind of took a good little blow, denying the expansion of the Medicaid program, which they lost a lot of money. But right now, Texas, were they saying now? Texas in 2017, nationwide, new regulations were put into effect. So it's a lot of nonprofits with more objections are now exempt for providing contraceptive coverage. Previously, the cost of contraceptives made up 30 to 44% of out-of-pocket healthcare spending for women. Now that's a lot. With contraceptive coverage, women have a choice of what contraceptive method to use. Many women were using longer-term contraceptives with higher effectiveness against pregnancy. With the new regs, most businesses in Texas can opt out of providing contraceptive coverage to women. So it really hadn't changed as much. But they do have new regulations, and a lot of people are opting out of doing it. Once the ACA went into effect, most women had no out-of-pocket healthcare spending for contraceptives used, with the estimated 1.4 billion in savings for women. So, women did not have to spend as much money on contraceptives, but they still, weren't getting the full coverage. Now in Texas have something that's known as, they call the state of Texas a contraceptive desert due to the difficulty in attaining contraceptives. Now they have developed a new app, and you can find it online. What I done was went on to Google and Google Nurex.com, and it pulled up the website of this new app that you can download. With Nurex, it's an app that prescribes and delivers birth control. They have nurses on here, they have doctors that will write your online prescription. They have over 50 brands of different birth control. You go on here, you can get free delivery, and you can get birth control sometimes at the lowest cost or at no cost. And it says you can at least get your first pack of birth control pills for $5 or free. So this is something that they have developed, and a lot of the women are using this for a sustainable long-term solution. It sends women birth control after filling out a questionnaire. You fill out the questionnaire, you get your birth control in a couple of days. You don't have to go to the doctor's office. The doctors online will renew your birth control prescriptions at no cost or the lowest cost. You can get them for $5, and I think a low cost option is even like 15. I mean, they have over 50 birth controls, so you can go with the long term or the shorter term, which is like the pill or something. What we recommend is that legislators consider the women consider expanding the number of health clinics and centers that provide full range of contraceptives at no or reduced cost to the public or through Medicaid. And even so, I look at it, we talk about women a lot, but there are a lot of men that can benefit from family planning. Also, some young men, if they have a lot of children or whatever, maybe they can get a vasectomy or things like that that can stop them from having kids. So I feel like that it should be broad, more broad rather than just females. You can have males that get the coverage also. This is especially important if Texas business owners continue to opt out of providing the family planning coverage at no cost. In 2016, health clinics served almost 26 million patients, and 1 in 6 were enrolled in Medicaid. So Medicaid played a big role in health family planning coverage in 2016. So who benefits from this is the logistics. Who benefits from this? So the low-income women, the women in rural areas, Texas business owners, and Texas as a whole. For low-income women and those living in rural areas, they benefit from having a local clinic to visit. Women living in rural areas have taken a big hit with clinic closures. That's true. I think our health departments, the one in my city in Mississippi, I think they're only open twice a month. And I can remember years ago they were there every day, but they're only open twice a month now. Um, So it says, a lot of women have to drive up to 300 miles to the nearest clinic. So expanding clinics in these areas should be a priority. The clinic expansion can be covered in a few ways: individual donors, Medicaid dollars, and grants. If business owners decline to or can afford to provide family planning coverage to employees, clinic expansions could provide their employees with the health care and contraceptives they can afford. Um, Third, the state benefits from the expansion by saving money in healthcare costs related to unplanned pregnancies. That is so true. In fact, health clinics have been shown to reduce the cost of healthcare spending by 24%. So, everyone can benefit if we look at this issue more seriously. So on this map, you'll see, the selected rural healthcare facilities in Texas. So you'll see critical access hospitals all over Texas, rural clinics, federal qualified health centers, skilled nursing facilities. You'll see how many clinics there are in Texas. Over the 254 counties in Texas, 75% are considered medically underserved areas. Oh, that's a lot. Health professional shortage areas are both, and 70% are rural. As stated previously, low-income women and those who live in rural areas are affected most by the lack of local clinics. According to this map, Of the rural counties, almost a third don't even have one clinic. These counties should be targeted for expansion first, ensuring that women living in these areas and with employers who do not provide the coverage have a nearby clinic to assess. Some health center numbers here are it's just saying 87% of health clinics provide family planning services, 176 health centers in California provided, and they save 24% on a average per Medicaid patient. These just are numbers we pulled. So where the funding come from? The funding, Medicaid covers almost half of health center revenue, and federal grants account for 19% of funding. And in the state that does not expand Medicaid, such as Texas, federal grants fund. Planning grants are available under the Public Health Service Action, Section 330, which allows the purchasing of land and hiring and training staff for the healthcare clinics. Other funding can be secured through a minimum visit and a sliding scale charge system. So you'll see Medicaid and federal grants are a big part of the funding. When you do a planning grant, like to build a clinic or other fund, private donations, things like that. So to sum it all up for us today, so right now, so here, it's just a little math equation that we came up with. So here's a little math that you can just keep in mind for today. The current state of Texas healthcare with the religious exemption employers can use to opt out of family planning coverage that's had contributed to the closure of clinics in an area that need one. These closures have affected the accessibility of health care for women in these areas, and adding locations can help alleviate difficulties with accessing family planning services. So you'll see the healthcare in Texas plus religious exemptions plus clinic closures in areas of need equals to a demand for health clinic expansion in Texas. So like I said, this is the end of my presentation. I really do thank you all for your time today. I found this to be a very interesting topic. I'm sure that as I go along, I will find more information about this. Um, I want to, you just go back and think about what I said in the beginning. Just imagine, being a young woman with the unplanned pregnancy and working for an employer that did not give you the option to have contraceptive, or you could not afford it. So what would you do? What do you think you would do in this situation? How do you feel about employers not providing this for their employees? Just I would love to hear your feedback about this. Again, thank you for your time. I hope you enjoyed it. On the next couple pages, you will see that we have all the references listed from our presentation. And again, thank you. Hope you all have a good day.